Alright, team, listen up. The patient presents with chronic atrophic rhinitis, intertrigo, and pericarditis. What are we dealing with here?
Those symptoms could point to a number of different conditions. It's hard to pinpoint just one based on that information.
I agree it's a tricky case, but we need to come to a diagnosis quickly.
Could it be juvenile hemochromatosis? Those symptoms align with that condition.
Bingo. Frank, you hit the nail on the head. It's juvenile hemochromatosis. And we need to act fast. The patient must undergo a vitrectomy.
Wait, are you sure about that? Vitrectomy is a risky procedure. Are you willing to take that chance?
Damn it, Gary. I didn't spend years studying medicine to second. Guess myself. Trust me, vitrectomy is the way to go. We're saving this patient's life no matter the risk. Let's get to work, team. Tracy, you called me in to discuss the vitrectomy procedure. What's the problem?
I understand you want to perform vitrectomy on your patient, but I have some concerns about the diagnosis of juvenile hemochromatosis.
Tracy, with all due respect, I have been practicing for over 20 years. I know what I'm doing. My patient needs this procedure to have a chance at recovery.
I appreciate your experience, Hawks, but I need to make sure we are making the right decision here. Let's talk through the diagnosis one more time.
I can't believe you're questioning my expertise. I have seen cases like this before and I know how to handle them. Trust me on this.
Hawks, it's not about questioning your expertise. It's about ensuring the best possible care for our patients. Let's go over the case together and make sure we're on the same page.
Fine, let's go over again. But trust me, Tracy, I know what I'm doing. This patient needs this procedure and I won't let anything get in the way of saving their vision.
Oh no, this is not good. The patient is in critical condition. I need to figure out how to break this news to Hawks.
It was not the correct treatment for juvenile hemochromatosis. How can I explain this mistake without causing panic or blame?
What in the world were you all thinking? You nearly killed the patient by choosing the wrong vitrectomy and misdiagnosing the condition.
I still think it was a case of vitreous hemorrhage, which required a different intervention.
No, it was clearly a case of epiretinal membrane. The signs were there.
I disagree. I believe it was a case of retinal detachment. It was the most likely scenario.
You bunch of incompetent fools. You couldn't diagnose your way out of a paper bag. You put our patient's life at risk with your sheer incompetence.
I can't believe I have to work with such a sorry excuse of a diagnostic team.
Storm's out of the room. I can't believe I still haven't figured out what's wrong with the patient in room 302.
Maybe you should try checking for an allergic reaction, or perhaps run some blood tests for infections.
I already did all that, Johnson. It's not as simple as it seems.
Come on, Hawks. You're usually the quickest one to diagnose patients. What's the holdup this time?
I just need some more time to think. It's a complex case.
Sure, take your time. I'll be here enjoying my lunch while you try to crack the case.
Suddenly, Eureka. I know what's wrong with the patient in room 302. Thanks for the suggestions, Johnson. I gotta go.
Confused, wait, where are you going? Hawks, you can't just leave like that.
I have a new diagnosis. Forget juvenile hemochromatosis. It's alveolar capillary dysplasia.
What are you doing, Hawks? You stormed in here without any proper medical equipment?
This is a serious operation, Hawks. You can't just make reckless decisions like that.
We need to follow protocol. Hawks, you can't just change the diagnosis on a whim.
Trust me, this is the right call. We can save the patient, but we have to act fast. Tracy, I finally figured out the right diagnosis for the patient.
That's great news, Hawks. Well done.
If only you had listened to me in the beginning, we wouldn't have had this whole mess.
What do you mean, Hawks? I thought we were on the same page.
I tried to tell you about the symptoms earlier, but it seems like my words fell on deaf ears.